Welcome back. So we were looking at the various aspects of cancer. We covered the biology of cancer, the steps of carcinogenesis, and some causative agents for cancer. Now we'll be looking at clinical features, staging, and some principles of cancer therapy. Now, how cancer spreads? There are two ways it can spread: hematogenous spread and lymphatic spread. And as I showed you earlier, the cancer cells cause angiogenesis, which means blood vessels grow towards the cancer cells, and then eventually cancer cells breach the vessel wall integrity and they enter into the bloodstream. They can also enter into the lymphatic channel. Okay, one example: melanoma. The initial tumor develops in the skin, and once the cells gain entry into the bloodstream, they can then lodge into the brain or liver. So this is how distant metastasis develops. What are the symptoms and complications of cancer? The symptoms can be divided into two major groups: local symptoms and systemic symptoms. Local symptoms are due to the tumor mass. So these could be unusual lumps or swelling, local hemorrhage, pain, and ulceration. Compression of surrounding tissues may cause pressure symptoms. If the tumor mass is located in a place where there is not enough room, it will cause pressure symptoms much early. If tumor mass is located in, say, for example, abdominal cavity, the pressure symptoms will come very, very late. There could also be erosion of the local tissues. What about systemic symptoms? These could be weight loss, poor appetite, fatigue, cachexia, excessive sweating, and anemia. Some tumors can produce hormones which could cause paraneoplastic phenomena. For example, lung cancer cells can produce antidiuretic hormone. So sometimes patients' first clinical presentation could be the paraneoplastic phenomenon. And then when you investigate, you find out that actually there is a cancer which is causing ectopic release of these hormones. Once disease spreads to distant sites or become metastatic, what are the symptoms then? Depends on where the metastasis has occurred. If brain is involved, there could be headaches, fits, vertigo. If lungs are involved, there could be cough, hemoptysis, dyspnea. If liver is involved, there could be hepatomegaly, and there would be jaundice. If lymph nodes are involved, they've become enlarged, they become hard to palpation. If bones are involved, there could be bone pain, there could be pathological fractures, and there could be spinal cord compression if the vertebral column is involved. What about cancer staging now? How do we classify how far the cancer has spread? Stage 1 is when the cancer is small. There is no spread from the original site of the cancer. Stage 2 is when the cancer has grown, but it has not spread yet. Stage 3 is the cancer has become larger and has now spread to the local tissue or local lymph nodes. Stage 4 is when the cancer has spread to other organ or organs in the body, which is metastasis. How do you diagnose and evaluate cancer? There are clinical staging system like what I mentioned to you in the previous slide. TNM is a system where you look at the tumor size, involvement of lymph nodes, and M is for metastasis, and you can give each cancer a score. It's a scoring system. Imaging techniques can be used starting from X-rays, CT scans, MRIs, bone scans, and there are many types of scans available now. Biopsy is where you take a sample from the tissue and you look at it under the microscope. There are certain blood tests can be done. There are some tumor markers which can be identified in the blood. Now, cancer screening is a very important tool because as we discussed earlier, cancer develops over a long period of time, and you want to pick up cancer during the early developmental phases where it hasn't spread yet, it hasn't become aggressive, so that you can nip the evil in the bud. Early detection of cancer can lead to better outcomes. This has led to many screening programs for common cancers. In some cases, even precancerous conditions can be picked up. Some examples of cancer programs in Australia are for breast cancer, breast self-examination and mammography; for cervical cancer, cervical smear; and for bowel cancer, regular fecal occult blood testing. Another concept is cancer prevention. How can we prevent cancers from developing? As we have seen earlier, there are some factors in the environment which we can control, okay, and some lifestyle factors. So these include smoking, diet, alcohol, occupation, sexual behavior, and UV radiation, and also certain viral infections. For example, HPV, human papillomavirus. HPV vaccine is a success story. It has been shown to be effective in preventing precancerous changes and is recommended for adolescents between 9 and 18 years of age in Australia. Now, what about cancer treatment? Once cancer has developed, there are different modalities of treatment that we can use. There are three major modalities. The first one is chemotherapy. Second, radiation therapy. And the third, surgery. But there are not three major modalities now. There are actually 6. What else do we have? We have immunotherapy, we have hormone therapy, and we have photodynamic therapy. But we're not stopping there. There's another one, which is called gene therapy. This is something which is undergoing major research and development. Now, as you can see, there are so many modalities for cancer treatment. It means that it requires cooperation of a multidisciplinary team to coordinate and deliver the appropriate treatment of cancer for each and every patient. Let's look at chemotherapy first. Conventional chemotherapy kills all rapidly dividing cells. Sometimes very high doses of these drugs are required with the hope that all cancer cells will be killed. Now, when you're killing all rapidly dividing cells, an unavoidable consequence of this approach is killing of normal actively dividing cells. For example, hair follicles, bone marrow, GI mucosa. Thus, any tissue which is dividing rapidly will be killed by these agents. It won't be able to differentiate between cancer cells and normal cells. So because of that, the most common side effects of chemotherapy are myelosuppression. Bone marrow gets suppressed. There's decreased production of blood cells. Hence, there is also immunosuppression because you're not producing lymphocytes. Mucositis, inflammation of the lining of digestive tract, and alopecia or hair loss. There are other side effects as well, like severe nausea and vomiting, infertility, and secondary tumors. So one of the main side effects of these drugs is you treat one cancer, a few years down the road, patient develops another cancer. So secondary tumors. Now we are using these conventional chemotherapy agents which are missing the target and they are killing all cells which are rapidly dividing. What about drugs that can hit the target? Can we have targeted therapy? Now there are newer anti-cancer drugs which act directly against abnormal proteins in cancer cells. And the first molecular target for targeted cancer therapy was the cellular receptor for the female sex hormone estrogen, which many breast cancers require to grow. Tamoxifen was the first drug developed as a targeted therapy. So this is a hormonal therapy plus a targeted therapy. Now, the search for better drugs in cancer is ongoing. A huge amount of research is happening in this particular field of medicine. Some newer drugs, I'm just going to give you one example, is signal transduction inhibitors. So one example is imatinib, which is approved to treat gastrointestinal stromal tumors and certain kinds of leukemia. So these are epidermal growth factor receptor blockers. It targets several members of tyrosine kinase enzymes that participate in signal transduction. Now, in summary, cancer is a heterogeneous group of diseases with wide range of causative factors. Understanding pathogenesis of cancer can help devise preventive strategies. Immense research is happening to produce better screening tools. Cancer treatment requires the cooperation of a multidisciplinary team: surgery, chemotherapy, radiotherapy, biological, endocrine therapy, and it doesn't stop there. You need people to help these patients cope with the trauma, psychological trauma of having a cancer. The improved understanding of molecular biology of cancer has led to several new and effective treatments, but there is still a long, long way to go. So please consult the reference from where I have prepared these slides. And that's all for now. I hope you enjoyed learning this topic. Thank you so much. See you next time. Bye-bye.